mamas, welcome back to my channel. I am Sade. I'm your dedicated lactation counselor throughout this entire experience. So today we are going to talk about pain and breastfeeding because there's a lot of different things out there about breastfeeding and pain, what it should feel like, what it should look like, and there's a lot of pushback on, well, should breastfeeding be painful? And some women do experience pain while breastfeeding, which is typically normal, especially in the beginning after you've just had a baby, because your hormones are changing, and as your uterus is like contracting and shrinking and getting back to its pre-pregnancy size, it is actually very normal to feel a little bit of pain, almost like you're having contractions again while breastfeeding in those early stages. And just until you get used to that sensation of breastfeeding, your nipples and breasts can feel a little sore in the beginning. However, is it normal for breastfeeding to be painful like always? No, it's not. You shouldn't always feel like this excruciating pain. You shouldn't always feel uncomfortable physically while breastfeeding. Usually pain is like a really good sign that something is probably not going right. So usually it's a latch. So if your baby's not latched on all the way, then it's a very good chance to yes, you are going to feel pain. So the latch is like the main thing I would look for if you are experiencing pain for weeks at a time with your breast. And usually that is because the baby is sucking on the nipple and doesn't have a lot of areola in its mouth, which could be an issue depending on breast size sometimes. And so it's like you really just want to make sure, depending on like the makeup of your breast, when you are feeding your baby, that you are holding your breast for support and you're really just getting a lot of that areola in the baby's mouth, because again, it is breastfeeding, not nipple feeding. So you really want to make sure that the baby's not just sucking on the nipple. Otherwise, you are going to feel a lot of pain. And it's very possible that you're either going to get engorged because baby's not really able to pull a lot of milk out when they're only sucking on the nipple. And you can get like those nads, like clogged ducts. You can get those milk blebs, or which are those like white blisters that can show up on your nipples or on your breast, and that's from your baby sucking too hard because they don't have a good latch. That's going to be super painful. Another common thing that can cause pain while breastfeeding are cracked nipples. Cracked nipples, again, it all kind of comes back down to your baby's latch. If your baby does not have a good amount of breast and tissue inside of their mouths while they're feeding, they are working harder essentially to get that milk out, and it's going to be painful. So it's really like when it comes to your supply, when you want to boost your supply, when it comes to, is my baby getting enough milk? It's the main things is going to be about that baby's latch. If that baby has a strong latch, then chances are you're not going to experience any of those things. If baby has a weak or shallow latch, chances are you are most likely going to experience those things. Now, if you do experience one of those things, or if your baby does have a weaker, shallow latch in the beginning, that is not no fault to you. Nothing is wrong with you. Nothing's wrong with your baby, right? Like, it's not like, oh my gosh, what am I doing wrong? Do not beat yourself up. You are not the problem. Your baby is not the problem. Breastfeeding takes practice. It's something that's new to you, and it's something that's new to that baby. Even if you're on your second or third baby, it's still not your fault, because all babies are different. All of breastfeeding experiences are different. My experience with my first son was super easy, and just like right off the bat, we clicked and it worked out. With my second, my daughter, it was not easy. As a matter of fact, I was like sitting in the hospital, and I was actually stressed, and I know what I'm doing. And I was like, wow, I can really see how this can be so difficult for a lot of moms, and why so many moms give up. Because if you don't have the right support, and if you don't know what you're doing, and if you don't have someone to come in and help you and show you what the right thing to do is, you're gonna really feel a lot of self-doubt, and you're really not just even gonna want to do it anymore. No matter how important breastfeeding is to you, you're just gonna think like, wow, maybe I'm just one of these moms who just cannot do it. And while that may or may not be the case, it's always good to have knowledge. It's always good to surround yourself with people who are knowledgeable about breastfeeding. It's always good to reach out to a lactation specialist to really get down to like the root cause of why you're experiencing pain while breastfeeding, or why you're experiencing a dip in your supply. And so of course, if breastfeeding is painful, right, like almost 8 times out of 10 you're not going to want to do it anymore, because who wants to be in pain all day long while they're feeding their baby? Even if you're pumping, you might still be in pain. So it's like, if it's painful, you're probably not going to want to do it. You're probably going to be like, all right, maybe this just isn't for us. And then, you're going to take another feeding route, right? So, before you throw in a towel or before you do any of those things, really just like reach out to someone and just figure out, okay, like what is going on here? Have someone come to your home, do a virtual consult. I do those. And just really like, try to work through it. Just slow down. Just remember like, okay, like let me just take a step back, look at the bigger picture, and like assess what's really going on here. Why is, this so painful? Why am I experiencing this? Why do I keep getting engorged? Why am I keep getting mastitis? I've had so many women who tell me like, oh my gosh, I've had mastitis like 3 or 4 times. And it's like, okay, that means like baby is having consistent times where they're not getting the milk. So what is blocking them from doing that, right? All of those things are going to play a factor into it. So let's talk about engorgement. Engorgement is when, your breasts start to feel hot, they feel really, really full, they might feel rock hard, and it's super uncomfortable. When you try to do anything, if you try to touch your breasts, they're just hot and they're just uncomfortable, and you just don't want to do it. And so that's engorgement. Engorgement happens when you're not releasing enough milk at a frequent pace. So if you are not nursing and you're going longer stretches, even if you're breastfeeding, breast pumping exclusively or what have you, you are going to want to consistently relieve yourself of milk. You're going to consistently want to express milk out every 2, 3, 4 hours at least. Letting it go any longer than that is going to cause engorgement, and it's going to be very painful. Granted, there's instances where you might be out and you might not be able to get to a pump or something in time, or your baby might not be with you, so you can't just nurse on demand to kind of relieve some of that milk, right? I always say like learn how to do hand expression, and always carry like containers or bags with you. That way you can just express into a bag or express into a clean container that's nearby that you can store away for later, because engorgement is no joke. Engorgement can be very, very painful, and it can lead to mastitis, which is an even bigger problem. And that is an infection in your breast area, and it feels like you have the flu. Like I thought I was dying. I didn't know what was wrong with me. My breasts were super hot. I had a headache. I felt like I had a runny nose. I felt like genuinely sick, and I'm like, oh my God, like what's wrong? Mastitis. And I'm like, I have mastitis. And that was not fun. Like it was not a fun experience at all. I highly don't recommend letting it get to that point over and over again, because ultimately that can eventually lead into possible, sometimes you get those blisters, and then you either have to go to your doctor, and your doctor has to drain it out, and it's super painful, it's super uncomfortable, it's just not a fun experience. So you don't want to do that to yourself. So just really learn how to hand express, really just try to keep a pump on hand with you, even investing into a non-expensive like hand pump or Haka or manual pump, or something that you can just keep in your car or in your diaper bag while you're on the go. That can really make a huge difference in your breastfeeding experience, and just preventing anything from happening that's going to cause you that pain while you're breastfeeding. And so always remember that if you are experiencing anything that may seem out of the normal, reach out and just try to seek support and seek help as soon as possible, because the longer you let these things go on and build up, the worse it's going to feel, and the greater chance is that you are eventually you're going to be ending your breastfeeding experience, because when those things build up and if it gets too bad, it gets to the point where it's like you almost just have it just causes damage mentally and physically on yourself. It's hard on your body, it's hard on your mental, because if you really want to be a breastfeeding mom and you're feeling all those things, it's not a good place to be in. So I highly recommend reaching out for support and anything like that. And then just know, breastfeeding pain is normal in the beginning. There are certain things that's going to cause a slight discomfort, but you should not be in so much pain to the point where you're just like, why am I even here? Granted, like if you got a blister or a cracked nipple and you're pushing through a few days while you're letting it heal and putting ointment on it, putting breast milk on it, coconut oil, all those things, that's fair, right? Like push through. But if you're pushing through for weeks and weeks and weeks at a time, and it's going to months and you're in so much pain like that, that is not okay. I don't want that for you. So just keep that in mind always. And then, of course, if you do get cracked nipples or blisters, the number one thing I recommend is always use a lanolin-based nipple cream. And that way you don't have to wipe the nipple cream off every time before you feed if it's lanolin based, because it's safe for the baby to ingest what you're nursing, because like who's going to remember to do that every single time? And the goal is like you want to apply it after each feeding so that way those nipples heal faster. And coconut oil also works really good. That's safe for ingestion as well. So those are like my two go-tos when it comes to sore nipples, cracked nipples, or anything like that. And so yeah, so that's what I got for you today. And then of course, if you have any questions about breastfeeding or anything like that, be sure to drop a comment down below. Follow me on Instagram if you're not already. Like and subscribe, of course, to the channel, so that way you know I drop a lactation video every Tuesday. So that way you are up to date on all the breastfeeding tips and things like that. And stay tuned for next week's video. Bye.